Okay, hello everyone. I'm so happy seeing you and being with you today. You can't imagine how my heart is jumping out of joy seeing you all. Um, I thank you for the invitation and het is verkeerd. And oh, this doesn't show as it's on my slides. It's changing it around. Matthias muss noch eens kommen. The slides are turned around in your presentation. I'm sorry for this. So, das sollte linksbündig sein. Okay, I hope you can understand it anyway. This machine changed it to the right side. So I was so happy to hear Claudio relating to nursing theories and the research he has done. He followed it in the last years. And several days ago, Jacqueline Fawcett has died. I was in close contact with her, and that this research now relates standardized nursing languages also to nursing theories is so important. And as you know, Fawcett was one of the biggest nursing theorists. I'm specialized in SNLs. I was professor, international researcher who constantly taught and collaborated also with nurses in clinical practice. And I was Ascendio president until 2023, and we were constantly collaborating with AENTE. I was in Madrid, in Gijón with its wonderful sea, in Valencia, and also visited the City of Arts after the conference, and of course in Cadiz. And when I got your invitation, I of course remembered Mercedes Ugalde, who has died several years ago, and Aurora, who was also president, Susanna, Rosaria, and now Maria Angeles. I greet you all and thank you for being here today. And as Aurora already mentioned, I was invited to visit her in Almunecar 3 years ago. This was another highlight of connecting with AENTE. I now named a few of you, but of course I greet you all, and I'm so happy. AENTE se despertó. And you awoke again with wonderful, best educated AENTE nurses. I am a fan, soy fan de los profesionales de la enfermería españoles. You have such a good self-confidence. You are always beaming of joy. And you Spanish nurses also have fashionable clothes, not as the Swiss or the German, who wear clothes like grey mouses. At AENTE, we always also got the finest Spanish food, and we had so long lunches served at tables with white tablecloths. And we had several courses, including dessert. And even at lunch, we would get wine. And at the AENTE conferences, the lunch would go for 2 hours. Therefore, I thought, oh, can these Spanish nurses be serious scientists? Are they really researchers when they just feed and celebrate and eat so long? Oh, yeah, the Spanish are excellent researchers. And at most universities, I have learned through the years that they do research on standardized nursing languages. And Aente was university-based since its beginning. That's not the same as Nanda, who was for most years just an association. So this helps to really implement the standardized nursing language into education and into research. And therefore, I was really always envious about the Spanish. And as Claudia mentioned this morning, we know that the Spanish and with the islands also, you publish most SNL studies from Europe. Therefore, when I was asked to participate here, I was still in rehabilitation, but I thought I have to accept this invitation, despite I'm now in pension and despite I had back surgery. And despite I'm not allowed to sit to prepare a PowerPoint presentation. And also, despite today is my 70th birthday. So, when you ask me to present or talk about looking to the future, everybody now talks AI, artificial intelligence. And it seemed for some years that standardized nursing languages could be forgotten because now AI does everything. But I know, and I was supported by serious AI researchers who said AI depends on SNLs. AI really needs to be connected to Nanda, Nick, and Nock. So I'm asking you, I like this not to be just a one-way presentation, but please, moderator, can you ask the audience, what do you think of this idea? What are your answers? Is this true? Does AI depend on SNLs? I don't see the audience though.
Espera.
¿Ya?
Sí, vamos a pasar. ¿Alguien tiene una respuesta a esta pregunta que ha planteado?
Yeah.
Mm,
Yeah.
No hay mucha respuesta, María. ¿Vale? Pero dicen que es evidente, que sí.
So he said yes, but why does he think it depends? Can he explain it a bit further why he thinks so?
Pues sí, si os parece bien. A ver, entendiendo la inteligencia artificial como una herramienta que a futuro nos puede ayudar a mejorar la precisión diagnóstica, la tenemos que entrenar antes de ello con los lenguajes enfermeros. Tiene que ser entrenada con ellos y con ellos utilizados en la práctica real y sobre pacientes reales para que pueda aprender de la realidad y luego darnos ese apoyo.
Yeah, well, that's an answer I like. Was this the person who gave the presentation before Claudio?
Sí, era yo, sí.
Yeah, that's what I thought. Oh, Nice. So I was giving a presentation in Rome last November, and as you know, everyone talks ChatGPT, and many don't see the connection between AI and standardized language at all. So I'm saying or explaining, why does AI need NNN? Or it's because these are diagnostic concepts. And when I did my master study 30 years ago, we learned science is based on concepts. Without concepts, everything is just a description. You cannot capture it, you cannot transport it, you cannot measure it statistically. So really, I think in nowadays nursing programs, as also Jacqueline Fawcett wrote, we should be much more aware between what's text and what's a concept. And a recent AI developer and researcher, he wrote books, and I heard an interview with him, and he said, "Oh, AI, it's not intelligent." And he always said, so-called artificial intelligence. And he said, don't forget, we only write algorithms, and AI itself is not intelligent. It's programmed by men and women, by human brains. AI also cannot think. It's not a brain. AI also cannot make human experiences or have feelings or touch a patient. Therefore, we need SNL experts, like many of you are, to develop the algorithms. And I know many nursing informaticists, but some of these just thought in informatic terms and not in nursing, and did not see the collaboration and the connection of concepts and, say, descriptions. And as this other researcher, who is an AI specialist, noted, he said, don't be fooled. AI can't truly understand text. It can't understand text. So even when ChatGPT seems doing this, it cannot analyze free text by its own. But it can compose concepts if an intelligent algorithm is programmed by an intelligent nursing person in our field, a nursing expert. And then we can use AI to help compose the concepts with the definition of NANDA diagnosis, defining characteristics and related causes. So it's important to know that if we put our energy into supporting AI developments and at the same time keep doing research and using standardized diagnosis, it could be good for the future if we do it right. So many years ago, and I think I even presented it at an AENTE conference, we published a standard on clinical decision support systems, nursing process clinical decision support systems. And of course, decision support system bases on algorithms. And at that time, in 2016, no one named the decision support AI, but it's very similar as AI now is in its main principles. So we developed an intelligent nursing process program, IT system, but not because the system itself could think, but because an intelligent nursing researcher developed this nursing decision support, nursing process documentation program. It's Matthias Odenbreit, my husband. And in this system, in the nursing care plan, it automatically suggests nursing diagnosis based on patients' cues. The cues, the observations the nurses enter into the system, even if it's free text from nursing history or from nursing assessment, the decision support did or does suggest related nursing diagnosis, which of course also has to be in the system linked correctly. So these algorithms linked the cues, now they are mostly named prompts, to the SNLs, and then if it was matching due to the algorithm, the signs and symptoms or the causes of the nursing diagnosis matched to the algorithm, it would suggest NANDA diagnosis, and then effective, coherent nursing interventions from the NIC/NOC linkage books, and also the desired patient outcomes. But as the colleague said, it's not enough to have the diagnostic labels or the intervention labels. We must also add the PES, the signs and symptoms, the related factors, and in interventions, when we, on this system, you go with the mouse over the intervention title, the definition of the intervention shows up, and then the activities of the NIC show up, and the nurse must select activities. She selects because the system supports her, but she is a thinker and a critical decision maker. And the system then suggests desired patient outcomes. Again, the nurse has to decide which outcome is appropriate for this patient, which indicator measuring the outcome is appropriate. So, to summarize this, AI, or as we named it, decision support, can only, but it's important and helpful, support nurses' decisions. Therefore, it's nowadays even more important than it was before that every nurse gets taught in these concepts: nursing diagnosis, interventions, and outcomes. Don't think the computer will do it for you. It will only suggest based on intelligent knowledge, which is in the classifications, but has to be put into the system by an expert, clinical master prepared nurse, specialized on SNMs. Otherwise, it's not going to work. So nowadays, many of my colleagues say, oh, I'm making a presentation and I ask ChatGPT and then it's already there. So, yes, take a close look. Sometimes it's not really wrong, often it's not specific. So, to rely on AI alone is dangerous. To rely solely on it is dangerous. One of these AI developers said, and he is the expert in AI, and he said, never believe AI in a field, in a topic that you don't know. So, even if ChatGPT tries connecting, it can only do what the algorithms do, and they have to be based, in our case, on standardized, valid NNN concepts and how they relate to each other. So I come to my last slide. And because you asked the future of INT, and I'm also citing here AI specialist, he said, this week, he said, even nowadays, nurses need more knowledge about this concept than without AI. More knowledge, not less. Knowledge, knowing what am I clicking on. Does it match to the patient situation? Does it match what the patient says? So, and what the patient asks and how the patients feel. And as you know, we have had such system 20 years ago in Switzerland. And the nursing full process was fully outlined in each hospital. With one screen, first it was of paper, of course, nursing assessment data, data relating to pain, then on the same logically assessment and pain concept, nursing diagnosis, pain outcomes, pain interventions. If a patient has 4 nursing diagnoses or 5, you see it all on one screen, logically put together. This is how it should be into practice. So it's feasible and usable and visible. And we could also stop writing long nursing histories in free text which no one has time to read, and which is often, sometimes it was specific, but never in SNL concepts. So we experienced, if we really teach the nurse in practice and in school to know the concepts, and then give them such electronic health records, these health patient records are much more better in quality. The nursing care plans are evidence-based with NNN behind it, and even not only behind but also on the screen. And nurses learned to speak Nanda. How comes nurses often know better medical language and medical diagnosis than nursing diagnosis? So back to this AI. This AI specialist said, nurses nowadays must know the difference of valid SNL concepts and fake, not validated AI connections. And the nurse must be with the patient at his bedside, listen to him, touch the patient, observe the patient, because AI cannot do this. AI can support us, a decision support, a very well developed electronic nursing process documentation system can super support the nurses. That's what we did in our hospitals. They had significantly better patient nursing diagnosis, highly significantly better, more effective interventions, and patient outcomes were highly significantly better. So, I come to my last questions. And I like then that you join as a group of AENTE. What does it mean, what I brought for AENTE as an association? What does it mean for you Spanish nurses? What does it mean for education, practice, research? Or what does it mean for IT developers? So I like now you to join the discussion, and the moderator knows how long time we have for this. I had prepared to talk 15 to 20 minutes, but I'm not familiar what's the time frame now. Thank you.